Your health. It's the most important thing in the world and the one thing most of us take for granted. You never know when it's going to fail you, but one thing is for sure, the best way to protect your health is to be well informed. Welcome to Your Health Matters. I'm Peggy Pico. The future is here. Sure, it's a bold statement, but in many respects, in regards to medicine, it's absolutely true. Breakthroughs in medicine are happening all the time, and the experts at Eden Medical Center are bringing many of these cutting-edge technologies to their patients daily. Advancements in medicine have brought the end to plagues, terminal illnesses, and life-threatening injuries for centuries. It's an integral part of science and medicine, yet most medical developments can go unnoticed to people outside of the medical field until they find themselves are faced with an ailment or an illness that has left them disabled and diminishing their quality of life.
You're going down about 20, 30 feet, as long as you can hold your breath, and a minute and a half, 2 minutes is your max. And I was actually up in Sierra Nevadas. I think it was like elevation 7,000 feet or so, and normal day, just diving with my brothers, and got a really bad pain this summer.
Matt Pancani is not your normal sinus pain sufferer. He had several dive experiences with no serious consequences, but on this day, that changed.
It was like the pressure didn't equalize. You know, usually your ears pop and everything, and that wasn't happening. And I was out for like 3 days. I just terrible, terrible pain.
Matt made it home, and after a visit to his primary physician, he found himself in the office of Eden Medical Center's Mark Ziem,
So how are you feeling?
who sees a lot of patients who suffer from sinus-related issues, like sinusitis.
Sinusitis is any inflammation or swelling of the sinus cavities that cause obstruction of the outflow and lead to the symptoms of sinusitis that we commonly see: pain, swelling, pressure, mucus, sore throat, postnasal drip.
Most of the time, sinus-related illnesses can be treated with antibiotics, but in the more serious cases where symptoms persist and return, more drastic measures are needed.
Other patients may develop an infection in their sinus that doesn't get better, period. The sinus remains blocked. We often can see that radiographically when we take an x-ray. Those patients are symptomatic despite multiple attempts at treatment. Sometimes it can go on for months, and in some instances even for a number of years. Those patients are also candidates to have a sinusotomy, to have their sinuses opened up and properly drained. If it keeps occurring, and despite medical therapy continues to occur, those are the type of patients who may want to consider a procedure to open up their sinuses, such as a balloon sinuplasty.
Before the development of this new treatment, sinus surgery was quite invasive and the recovery time was long. But now, with the development of balloon sinuplasty, that's all changed.
Previously, patients who had recurrent or persistent sinusitis had to have their sinuses opened up, which is where we may do it externally through an incision on the face, or we may do it internally, where we actually place an endoscope into the nose, find the opening of the sinuses, and then use cutting tools to actually open up the sinuses and go in and clean the sinuses out. With balloon sinuplasty, what we're able to do is insert a catheter directly into the nose and then insert a balloon into the sinuses, which we can gently inflate. By inflating the balloon, what we're able to do is microfracture the bone while stretching the mucous membrane, and do this without actually cutting any tissue or removing any bone. So this can lead to less scarring, less bleeding. There's less need for packing, sometimes no need for any packing at all. And the patients can return to their regular activity, often within 48 hours.
That was good news for Matt. He was relieved to find out this procedure had changed from the horror stories he had heard before.
It was beforehand, it was basically done with drills. And they had a real big problem with them. One, a lot of pain. Two, the drill bit going up there and puncturing the sac that encases the brain. And I asked Dr. Ziem about that when I first came in. He said if that happened in this situation, because they used that little plastic balloon, he'd have to write a study on me, because it'd be the first time.
Although Matt isn't the typical patient that sinuplasty benefits, it was still the best choice for him. since it was his frontal sinuses that were blocked. Those are the ones that tend to be the most difficult to successfully open up using the usual older techniques. They often required lots of bone drilling, external incisions on the face, and the sinus openings were often complicated by scarring, which could close back up and then require even more surgery. So Matt's experience highlighted some of the balloon's main advantages over traditional sinus surgery. Much less surgery, less pain, quicker recovery, and better healing.
I went in, I went under. Next thing I know, I'm back out. They're asking me how my pain is. Monitored it really well. Got out. I didn't have any packing, no bleeding. Left the hospital, went home. Kind of just took it easy for the day. Had to sleep upright, and the recliner didn't really like that too much. But next day, you know, I was like, wow, I can't believe I had surgery.
It's a lot of results for a little balloon. Now, Dr. Sydney Wanatek, Vice President of Medical Affairs at Eden Medical Center, joins us with some more ideas on how this balloon sinuplasty is actually helping people in regards to a little bit different than traditional sinus surgery.
Well, Peggy, the major advantages are it's a less invasive procedure. You're not cutting tissue, you're not destroying bone, you're not making incisions. So patients will experience a lot less bleeding. Oftentimes they'll leave with no packing whatsoever, no gauze up in their nose that has to be removed later. They have less pain, and the recovery is much quicker. They're back doing everything they want to do within 24 to 48 hours.
Which is a lot speedier than traditional surgery.
Much faster than a traditional method, a lot less painful, and a lot less invasive.
Will it treat sinus headaches? A lot of people have sinus headaches from either allergies or something else. And will it treat migraines?
I'll answer your second question first. It won't treat a migraine. It will treat headaches that are related to clogged sinuses. Migraine is a completely different kind of headache. It's a vascular headache affecting the blood vessels of the brain. But anything that involves the sinuses filled with fluid, this can help to alleviate those symptoms.
Certainly a good option. Now, when we come back, we will learn how the experts at Eden Medical Center are using minimally invasive techniques to replace the old traditional way of hip replacement.